by and large, what we found was that a lack of basic primary care, outpatient care, basic gynecological care, preventive health, and also the conditions that prevent illness in the first place, like in the case of diarrhea, sanitation, for example. These were driving morbidity to begin with, and then for the insured, a reason for them to seek hospitalization because the illnesses just wouldn't go away. And that's an interesting finding because theoretically, we deemed insurance to be something that would cover tertiary care, maybe secondary care, but certainly not putting people in the hospital for primary illness. However, given our context, what it's doing is serving as a health protection mechanism. Now, the third set of findings around the health education intervention, they're preliminary right now, but what we do find is that health education increases preventive health behavior. So for the women exposed to the intervention who had sat in an intervention with community health workers, they were more likely to wash their hands, to use a range of mosquito prevention mechanisms. They're also more likely to use the public system, which was very interesting because the majority of our population uses private care. What we haven't found yet, but we are still doing more analyses on the claims, is a difference in hospitalization due to the intervention. But given what we've learned about the drivers of hospitalization being a lack of primary care and also the basic living and social conditions in which people live, that's not a surprising finding. Education seems to be one small bit in a much larger set of interventions that would require primary illness to be treated in primary settings and leaving insurance to really deal with larger and what could potentially be catastrophic illness expenditure.